Hello, Senior Seminar 2025. My name is Tammy Bio, and we are going to review a journal article that reviews the effect of dialectical behavior therapy, specifically on a group of patients that are being treated with methadone maintenance for opioid dependence disorder. So we'll be discussing what DBT or dialectical behavior therapy is, and then with the journal article, we are going to review the method, the results, and then we will discuss at the end. So dialectical behavior therapy, also known as DBT, is defined by the Cleveland Clinic as a type of talk therapy for people who experience emotions very intensely. So Razi and colleagues 2020 wanted to evaluate the effects of dialectical behavior therapy on emotional regulation, distress tolerance, craving, and depression. And they decided to study this with patients with opioid dependence disorder who were currently being treated with methadone maintenance. So they performed a clinical study in an Iranian society. They included 50 men that had been referred to a methadone clinic, in which they did half of the men just received the methadone maintenance treatment. The other half, they received the methadone maintenance along with the dialectical behavior therapy. So research was collected from the structured clinical interview for Axis 1 disorders, the emotional regulation questionnaire, the distress tolerance questionnaire, the instant craving questionnaire, and the Beck depression inventory. So data was collected at 3 different stages. They collected it before treatment, after treatment, and then they did a 3-month follow-up. So the statistical analysis was conducted by utilizing the Kolmogorov-Smirnov test, the Lyons test, the chi-squared t-test, and then repeated measures. So they did find that the group that received the methadone maintenance treatment combined with the dialectical behavior therapy did show a significant improvement within their emotional regulation, distress tolerance, with reduction in cravings and depression. And then the group that received just the methadone treatment did not see a change. So what does this mean? So within the study, their data analysis does prove that dialectical behavior therapy is appropriate and effective in treating psychological problems of patients that are under methadone maintenance. So it talks about with future direction that DBT is based on 4 main skills of mindfulness, emotional regulation, distress tolerance, and interpersonal relationships, and that this psychotherapy could be beneficial in other mental disorders. And I think DBT is a pretty well-known therapy within the world of psychology. Now, their intent behind this was to see if there was a difference, can we start utilizing that? Because with methadone, although it is an effective treatment in a lot of situations, this study was talking about the different side effects because it is a drug that is used for the treatment, but it does have several side effects, including there was constipation, drowsiness, sexual problems, bone and joint pain. Those are very common side effects with the methadone maintenance treatment. And I think their theory behind it is if we can do something to work out the problems with establishing coping mechanisms, giving them emotional regulation and how to handle whenever those cravings do come on or when they're put in certain situations, if they can handle it with therapy versus a maintenance or even do both and be able to control those cravings and be able to handle the situation in the future, then that will in turn be able to reach more people. So limitations to this study was the size group, the gender, the types of drugs, and then the demographic composition. Obviously, with it being in an Iranian society, um, that's not a very diverse sample. It was just men. I would love to see this study including women. And then on a broader study, DBT with different types of drugs to see if those that are in treatment programs, whether inpatient, outpatient, if they do the dialectical behavior therapy versus people that are just in inpatient or outpatient, not completing therapy, if there would be a difference in their cravings or their emotional regulation, and see how that data looks. I think that would be very interesting. So these are my references. If you have any questions, you can reach out to me, send me an email or a message, and I would be happy to talk to you about them. Thank you so much for your time, and I hope you have a great day.